EMR stands for Electronic Medical Records, which are digital equivalents of paper records. EMRs typically contain general information such as treatment and medical history about the patient as it is collected by the individual medical practice. OpenMRS is an open-sourced online database programmed to simulate a fully functioning electronic medical record system. Electronic medical record systems are defined as electronic record of health-related information on an individual that can be created, gathered, managed, and consulted by authorized clinicians and staff within one healthcare organization. They have the potential to provide substantial benefits to physicians, clinic practices, as well as creating tangible enhancements for the organization. So upon launching the program, I'm gonna log in my username and my password. So we will be in the inpatient ward for this session and then log in. You can find the patient record, have active visits, register a patient, capture vitals, appointment scheduling. Since we have a new patient, we're going to register the patient first. Upon registering the patient, we're going to be giving their demographic data. First is their given name and then their family name. So Lily Evans. They can also be an unidentified patient. Gender, female. And I'm not going to put down the birth date, but I'm going to put in her age. Next, I'm going to input the patient's address. Phone number. So I'm going to type in the patient's phone number. For relatives, I will not be putting anything. A quick summary of the demographic data will be shown, so the name, the gender, birth date, address, phone number, and of course the relative. You have the choice to confirm or to cancel. I'm going to confirm since the data is correct. We have now successfully created the patient record under Lily Evans. On screen you can see is her patient record. So patient Lily has no recent visits because this is her first time. In her patient record you can find that there's diagnosis, vitals, latest observations, health trend summary, weight graph, appointments, recent visits, family, conditions, attachments, and allergies. So we are going to be inputting these things. We will be doing that by starting a visit. A confirmation box for the visit will then pop out, so I'm going to confirm. We are now under visit, so this is an active visit. As you can see, we have the choice to end visit, create a visit note, admit to inpatient, capture vitals, and attachments. You can create an appointment by clicking on appointments, so it has an optional time frame. So patient has no appointments and no appointment requests. As you can see indicated here, the patient is an outpatient. So what I'm first going to do is go to visit note. Here you will find primary diagnosis, secondary diagnosis, clinical note, presumed or confirmed diagnosis, which is required, the date, the location, and of course the provider, which is me. So I will be typing down her diagnosis, which is constipation. It shows up as non-coded constipation, so I'm going to click that, and it's going to appear in the primary diagnosis. So after typing down the primary diagnosis, the second diagnosis that I'm going to type will be the secondary diagnosis. In this case, it is an episiotomy. I will also be putting childbirth, so they are all non-coded. I put down episiotomy and childbirth because the constipation of the patient is due to the episiotomy and childbirth, that of which I will be further explaining later on the NCP. So since I am the nurse, I will be putting down information that is most essential to the patient's current diagnosis. I will be putting my subjective objective assessment, the vital signs, the diagnosis, the plan of outcome, the intervention, the rationale, and the evaluation. Once that is done, I'm now going to click save. It will bring us back to visits, and this time we're going to proceed to capture vitals. So under vitals, we will find the usual, the height, the weight, the calculated BMI, temperature, pulse, respiratory rate, blood pressure, and arterial blood oxygen saturation. So my patient's height is 157.48 centimeters. And my patient's weight is 64.41 kilograms. So OpenMRS automatically calculates the BMI. In her case, it's 26, which is considered to be on the side of overweight. Next, I put in her temperature, 36.9, which is normal. Her pulse rate is 93, and her blood pressure is 100/80, which is considered as a low blood pressure. I was not able to take her blood oxygen saturation. I'm going to confirm, and then a quick summary of my submission will show up. I'm going to be clicking save. This saves our inputted data. We are then back again into visits. Under encounters, you can see that it has logged in my visit note and then my vitals. Here you have the choice to edit or view it. I'm going to view the vitals. I've checked it. I'm going to be exiting again, and then back to the visits page, and now I'm going to end my visit. Another confirmation box will pop up, and I'm going to click yes to end the visit. Now it says here there's no active visit because we have already ended it. I'm going to now click the patient's name. So that basically pulls up the patient's chart again, and right now, the info that I have inputted earlier can be seen here. So there are the vitals. In latest observations, it is noted that the weight, height, and temperature, systolic blood pressure, and diastolic blood pressure was inputted today. Patient chart also has a health trend summary as well as a weight graph in order to track the patient's weight. It also has appointments. So I did not register anyone under family for my patient. There's no registered conditions right now. You also have the choice to put an attachment to the patient's chart. And my patient has no known allergies. Now we're going to click the home button so we can return back, and we're going to find our patient record to check. So I can already see the name Lily Evans here, but I will still be typing it. So my patient has appeared. Upon clicking on it, it brings us back to the patient chart. So to ensure security and privacy, we're going to log out. And that is basically it. Utilizing OpenMRS is very easy and intuitive. Upon trying it out, it's easy to imagine of using such a system in a hospital, as it will improve communication and also save time and space. It also serves as a central referential point for the entire healthcare team, because we are able to put all of the information from many eyes, many observations into one entire body of information, which we can access to provide better care by using it for the assessment and diagnosis. Speaking of such, we will be proceeding to the NCP for the patient diagnosis, and we'll be going through the add by nursing process. So earlier we put the patient's data in OpenMRS. So in clinical notes, I put in the following information, which is for the NCP. So for assessment, the subjective data of my patient is that she verbalized na, 2 araw na po akong dinatae simula noong mga anak ko. And then for objective, so earlier we put the patient's data in OpenMRS. So in clinical notes, I put in the following information, which is for the NCP. So for assessment, the subjective data of my patient is that she verbalized na, 2 araw na po akong dinatae simula noong mga anak ko. And then for objective, upon observation, the patient has not defecated for the past 2 days. So it confirms her subjective claim. For the temperature, the patient is 36.9 degrees Celsius, pulse 93 beats per minute, and the respiratory rate, which is 18 breaths per minute, all of which are normal. But her blood pressure is 100/80. This is considered blood pressure. But you have to take note that my patient is a postpartum patient, and she just had an episiotomy about 2 days ago. Therefore, she is experiencing blood loss. So when we lose blood, of course, the volume of the blood that is running inside us becomes less. Therefore, it is not able to create as high of a pressure. That is why when we lose blood, our blood pressure, which is relative to blood volume, also becomes low. Her food intake, she is already on a full diet, but she eats late. And her fluid intake, she drinks approximately 1 to 2 glasses of water every 8 hours. So the nursing diagnosis for the patient is constipation related to low fiber diet, inactivity, and low water intake. So usually for medical diagnosis, it would be constipation due to the episiotomy and childbirth. But for the nursing diagnosis, so it's related to low fiber diet, inactivity, and low water intake. So the patient has a full diet, but she does not eat enough fiber. She is also inactive due to her episiotomy wound. It hurts when she moves. That's why she does not move a lot. That's why she's inactive. And of course, her low water intake. So how do we justify this diagnosis? How is low water intake, inactivity, and low fiber diet related to constipation? So we will be going online and searching for other sources. Okay, so my video got deleted, but this will be our first source. So we're going to check first whether they are legitimate. So University of Rochester Medical Center. So they have physicians and they have hospitals. They conduct evidence-based research, clinical care, economic hygiene. Overall, they seem to be a very trustworthy facility. Let's continue. So according to them, the relation of drinking water in terms of constipation is that your stool gets hard if the large intestine absorbs too much water. So if you don't drink enough water and the large intestine absorbs the water within the stool, that causes constipation. So why is it that the large intestine tends to absorb too much water? This is because if there's no muscle movements or peristalsis in your colon, the stool remains in that area, in the large intestine, in which case it absorbs the water, so the stool becomes hardened. That is why activity is also related to constipation, because by moving, it stimulates the peristalsis or the muscle movements or contractions of our colon. Lastly, with regards to fiber, a low fiber diet, we have Healthline, so we're going to check. Healthline Medical Affairs team ensures Healthline's content, products, services uphold highest standards of medical integrity. So Healthline has physicians, nurses, public health experts, patient advocates. So they are truly trustworthy and they do evidence-based research. So according to them, larger, softer stools help keep you regular as they move more quickly. Okay, so our body can't digest fiber, but eating enough of it is thought to be very important for your gut health. This is partly because dietary fiber increases the size of your stool. This is why it's important. This is why low fiber causes constipation, because it does not increase the size of your stool. So by increasing the size of the stool, it makes them softer. So larger and softer stools help keep you regular as they move more quickly through your bowels and are easier to pass. Okay, so continuing with the plan or outcome. So for short term, after 8 hours of nursing interventions, the patient will establish or return to normal patterns of bowel functioning. So after our shift, the patient must have defecated. And for the long term, after performing nursing care and all possible nursing interventions, the patient will be able to verbalize health teaching and be able to adapt a holistically healthier lifestyle. So the long term plan is that the patient will have known how to prevent constipation, and what to do when you are constipated. So the following are the interventions and their respective rationale. So for intervention, determine stool, color, consistency, frequency, and amount. So by determining that, it assists in identifying causative or contributing factors and appropriate interventions. So for example, if the stool is black, it indicates that there is blood that is coming out of the stool, and if it's yellow, it means there's too much fat. If green, it is passing too fast. Uh, Another thing is that, of course, the frequency and amount and consistency. So the consistency of constipated stool is that it's hard, and it's not frequent, and it depends whether it's big or small. It's usually big because it's already constipated. Auscultate bowel sounds. So bowel sounds are generally decreased in constipation because they indicate peristalsis or movement of the muscles of the colon. So therefore, if you cannot hear any bowel sounds, it indicates that the muscles in your colon are not moving. That is why the bowel is not passing. So 3, encourage fluid intake. So it assists in improving stool consistency, as we discussed earlier. 4, recommend avoiding gas-forming food. It decreases gastric distress and abdominal distension. This is because when you're constipated, gas cannot properly pass through because there is feces or stool that is blocking. So therefore, it causes you to become bloated. So the abdominal distension. So it causes gastric distress. So the patient may be uncomfortable. So by avoiding gas-forming food, it will prevent further discomfort. So assist in perianal skin condition, frequently noting changes or beginning breakdown. So it prevents skin excoriation and breakdown. So since the stool, when it comes to constipation, is very hard, it may cause bleeding or may cause breakage of the patient's perianal area, especially with the patient that we have. She is a postpartum and has gone through episiotomy. Therefore, she already has a perianal wound and cause their anus to bleed. So discuss use of stool softeners and laxatives. The rationale for that is that it facilitates defecation when constipation is present because they soften the stool. And then last is high fiber rich foods. They enhance easy defecation, like I said earlier. For evaluation, lastly, after 8 hours of nursing interventions, the patient must be able to establish or return to normal patterns of bowel functioning. So by the end of our shift, which is 8 hours, the patient must be able to have passed stool or is passing stool normally. So we have tried OpenMRS earlier, which we have discussed is basically an electronic medical record system. So we're just going to discuss a little bit how electronic medical records improve the delivery of healthcare management. So first of all, it provides accurate, up-to-date, and complete information about the patients. So with an EMR, it enables quick access to the patient records, through computers for more coordinated and efficient care. So you don't have to borrow a patient's chart. You don't have to look for it. Two people can look at it at the same time. And at the same time, it's accurate because it's always updated and it has complete information from the health team, from all members of the health team. So it helps providers more effectively diagnose patients. It reduces medical errors and provides safer care. How is this? Because they can diagnose the patients more accurately and effectively because they have access to the complete information that is created by the observations of all of the members of the healthcare team. It reduces medical errors because we can cross-check, and applications can also have ways of preventing errors such as confirmation boxes, and overall, that provides safer care. It helps promote legible, complete documentation and accurate, streamlined coding and billing. So, this is also under providing safer care. So, for example, if a doctor were to write a prescription and their handwriting is not legible, it can lead to medication errors. So, by having them computerized, they can be easily read and prevent medication errors. Next, we have enhancing privacy and security of patient data. So, by EMR, it's securely sharing electronic information with patients and other clinicians. It can be passcoded or passworded, so that's a way of ensuring privacy and security. And it can even have biometrics included when checking, so that we know that only the personnel and the people allowed to see the patient's data will be able to see, and no other person. So it also reduces costs by decreasing the paperwork. So that is basically it. So thank you for watching the entire video. I hope you learned something, and I will be seeing you next time.